let's go over this question about the brain reflex. We work on those reflex. And you remember that you have about, I said 28 because we don't count some reflexes left, right, up, down. You can have to 40 reflex at birth that are active for survival. The first one that we know, but it may start earlier, is the fear paralysis reflex, which is an equivalent of a frozen response. We feel the baby touching the wall of the uterus between 5 and 7 weeks intra-uteral. And most of those reflexes, we see them integrate 3 months, 6 months, some stay up to 3 years. But if you go to school today and you test 7 years old, 9 years old, 15 years old, you feel that they have a lot of reflex not integrated still. And that is going to create a lot of problem. And sometimes I describe this as a tadpole that needs their tail in water to be able to move. But once a tadpole turns into a frog, you don't want your tail. It's time to jump. You need to have those structures regress, not be active anymore. And unfortunately, when your reflex are still active after 6 months or after 3 years, depending on the reflex, it creates a lot of problems. One of them is learning, and it could be balance, posture, memory, math problem, all kind of things, including emotional problem, postural, mental, emotional, even spiritual problem. So it's really something, and many teams look into it, but the main treatment are movement. So there's one called the grasping reflex. You still grasp. And if you do movement like that, once or twice a day for 6 months before you inhibit the reflex, it makes the parents so tired of doing it every day. The kids are so sick of it. It takes a long time. It takes a few months, up to 6 months. So it's very long. So we find a way to gently being able to inhibit those reflexes. We have those reflexes that also come back, especially after a trauma, emotional trauma in adults. So when you see someone that's very nice and very balanced and very polite, but in a stressful situation, and you have seen that, all of you, someone that regress, begin to be like, you begin to be an animal in the worst case. When you have this, you regress in the hierarchy of your nervous system, and most probably you reactivate one of those primary reflexes. Rather than use a sophisticated behavior, elocution, talk, and movement, you're going to go back into a very primitive way. Whatever you regress into, you most probably have one of those neonatal reflex or perinatal reflex that are reactivated. So they can reactivate emotionally, or if there's a stress, there's a fire, but they can also happen if you have a stroke, if you have Parkinson, dementia, brain cancer, something like this. So it happened in adults, and especially when you see people in old age bent in half, that's a reflex that come back. Sometimes if you go to your grandpa, they begin to like to put a lot of things in their mouth, sucking reflex. They grab your hand, they don't let go, grasping reflex. You need to re-inhibit them at some point with aging, and especially if you had some pathologies described here in the slides. In kids, it's an enormous amount of problem that can happen to them. And you often discover them when they have school problem, learning problem. And you have a list here, from sensory disorder, trauma, PTSD, CP, ASD, autism, ADD, ADHD. So any kind of problem that must focus, concentration, writing problem, vestibular, balance problem, posture problem, social skills. They can be really isolated in their tower. They can be really aggressive. Dyslexia, dyscalculia, dysgraphia, dyspraxia, speech developmental disorder, auditory and visual processing, autism, Down syndrome, etc. All those things going to tell you, wow, this is a red flag to use one of those reflexes. So those reflexes become not integrated, not inhibited. We call that retained reflex. All those words are synonym. This reflex as persistent in adult. There's a description I found somewhere of this and that reflex is in the brainstem, this reflex in the medulla, this reflex in the midbrain, this reflex in the cortex. But this is absolutely not what we find. This is not very scientific. Any reflex can be searched anywhere in the central nervous system. This is one of the questions I see a lot. And some books describe that, but that's absolutely not what we find when we test and palpate. Because there's a theory, there's no imaging done on that. There's just an assumption. When you feel with your hand, and that's the benefit of feeling, you can really see what's happening. You don't feel that at all. Any reflex can be stuck anywhere. That was a question, basically. I just went over to give you an overview. This is brain reflex, brain neonatal reflex. And the treatment is very, very gentle. Just type on YouTube reflex and Chikly, and you could see us working with a lot of reflex. See how gentle and how fast it is to treat. We have like 6 or 8 videos on the brain. The reflex is very, really fast.